Good afternoon, everyone. We only have a few people on, which is great. We're going to go through a quick informational slide deck, and then we'll open it up, and so we'll able to see you and try to answer any questions you might have about this grants program. So this is a quick update expanding COVID-19 vaccine support grants in New Hampshire to independent practices. So a couple other programs that the Medical Society has been doing related to COVID-19. We started early in the pandemic with our Mask Up New Hampshire campaign in conjunction with the New Hampshire Hospital Association. Next slide. And then through December through August of last year, we sponsored a weekly COVID-19 vaccine alliance meeting, where we did updates on implementation of vaccines coming into the state. That was very, very successful. Finally, I want to let you know about another program we're doing. We're working with 4 hospitals in Coos County to launch a mobile clinic, essentially a high-end Mercedes Sprinter 4x4 van that will is due to be delivered mid-year. We've raised just over $1 million for this effort, and it'll be used for immunizations, preventive services, and primary care by those entities, and probably some other partners as we move forward along. So it's going to allow us to pay for the van and move for 3 years of funding. Next, I want to do an overview of the grants we're going to be talking about today. So these grants, which are a little over $2 million, were approved by the Executive Council in late December. It's being facilitated by the Medical Society through the Department of Health and Human Services Division of Public Health Services. And these are CDC funds that are mandated through the American Rescue Plan. What is it? It's over $2 million in grant funds, and it's really to help you increase your vaccine infrastructure and capacity as we move forward. So the dirty rotten secret here, it's about COVID-19 vaccines, but it really applies to any other vaccines that you'd be dispensing or administering. And this is targeted for independent practices. So if you're part of a community health center or FQHC or a hospital, or you're affiliated with one of them, then there are other grant funds that are going to become available. We're just the first ones through. So now so the first round is really from now. We'll start reviewing grant applications on the 11th through April 1st. And so every, we'll call clinic or practice can submit up to 1 application, but it could have many parts to it. And then if there's any funds left, then we'll go through a second round where all facilities again or practices can reapply. What's included in the grants is fairly broad, relating to the provision of COVID vaccines. So this is retrospective for any expenses occurred after October 1st, 2021, and to the time you apply for the grant. It covers clinical support, administrative support, including IT assistance. It also includes equipment, freezers, refrigerators, data loggers related to immunizations, as well as supplies, and computer software. So if you have an EHR that doesn't enable, say, HL7 messaging, then that's something we can also help you with. And you need that HL7 messaging capability so you can batch mode log into the vaccine registry for New Hampshire, or the IIS, the information system. The requirements, once you receive the funding, are pretty simple, pretty straightforward. It's quarterly reporting. There's about 9 or 10 elements. Most of those are text-based, a few data elements for 1 year. So 4 reports, they'll be online, they'll be easy, straightforward. And the landing application, I think we just put it into the chat, and the application can be found at our website under grant-application. So that's a little bit of the, if you have any further questions and you want to talk offline, please email me, james.pottard@hms.org, or you can call the number 603-224-1909. And we're happy to, to answer any questions that you might have that we didn't cover in the session, or during the application if things come up that you have questions about, we're happy to answer them. So at this time, what we're going to do is we're going to just open it up. We're going to turn on you'll be able to turn on your cameras and screens if you'd like, and open the phones. So if you have any questions, we'd be happy to answer them at this point. And you can either text them in the chat box, or you can just unmute yourself and ask away.
I am promoting folks to a panelist role, so you might have a little pop-up that'll allow you to be able to do camera and audio. So if you can just accept that, thank you.
So any questions you might have, either about the process or the application that you might have? And if you just unmute yourself, we'll take anything you have.
Everybody should be back in now, Jim.
Okay. Any questions that you all might have, please feel free. Turn on your cameras, you can unmute yourself, and we'll be happy to address any questions you might have about the grants or the application process. The application is online. If you haven't seen it yet, it's pretty straightforward. We ask you if you have the clinical or administrative personnel requests. We give you a spreadsheet. You just essentially plug in the information. But we're really interested in the pay rate and the hours to come up to a total figure for that individual. And again, it's retrospective back to October 1st until the time that you apply for the grant. I'll also mention, if there's things like you have to go and you're going to have to do some research on EHR upgrade or anything else, then we're happy to, to take information. What I typically ask will be, send me an email with the scope and general ballpark price of what you're going to do. And if you're doing that due diligence, we'll have a quick conversation, but then we'll try to hold those funds aside to a little bit later in the first round of the grants. So as you can see, thank you, Brian, for taking us kind of through. It's really just a couple uploads. So it's either a document, it has two phases, again, for personnel, the other side is for equipment. Put that information in, upload that, and then any supporting information like receipts or invoices or personnel records to justify that those people were working for you in this capacity. And again, it applies not only to direct services clinicians, but it can apply for administration. So your schedulers, if you had to create a website or some other things through the provision of COVID-19, then you can also apply and have those services reimbursed for. This again is really just to kind of help you, get through and provide COVID-19 and other vaccines, immunizations down the line. And I think the state's real interest is to make sure that you can come up and potentially batch mode in the system if that's something that you choose to do, rather than individually logging each case in. So any questions from those who are participating? Deb?
Jim, hi, Steve Cates here on Deb's screen.
Hi, Steve.
We're sharing the screen. Hi, just a quick question. We probably are in need of a new refrigerator and freezer. We haven't purchased one yet. Mm-hmm. Do we have to buy it first and then apply for the grant, or can we apply for the grant and ask for money for reimbursement when we get it?
Yeah, well, you can do it a couple different ways. So I think we would even take an invoice. So you go out and you choose, and I was researching some of them. And say you want something smaller, but you want a dual, something that's regular kind of medical refrigeration, and other that's deep freeze. Done some research, and those are $2,000 to $3,000. So you would go and get an invoice, say, hey, you're going to do that, submit that to us, and then all we'll have to do is add after that, we'll likely pay you for that. So we don't necessarily have to have, you don't have to expend the funds first, particularly if it's something higher end, like if you're going to upgrade software or something like that. So we'll work with you to make it easy, flexible, as long as we kind of get just final documentation to justify the reimbursements or the expenditures is all we're really looking for.
Yep. And in terms of what we buy, that would be, even if it's good for general immunizations, that's fine. It doesn't have to be COVID specific.
Does not have to be COVID specific. The goal is using COVID funds to really help prop up all immunizations.
Okay, we do a lot of that. And then the last question was, how much time do you think will be involved doing the quarterly reporting?
We're hoping it's going to be minimal. So it'll be an online report. There's, if you look to the landing page that we have, the second page gives you each of the items. Okay. So if you scroll down, takes you through the application process, a little further, quarterly reporting. Go ahead, a little further down. So it's just these 9 elements is all we're going to ask. Most of these, as you're going to see, they're text-based, so they're just a question. It's like, how are you doing? Can you give us a sentence or two on how it's going for each of those questions? So a couple data elements. They just kind of want to know how much you're doing, whatnot, and if you've moved into the IIS, how that's going. So pretty straightforward. I think, something like this, if you have the information in front of you, it's, 10, 15 minutes probably.
Okay, great. Thank you.
Mm-hmm. Thanks, Brian. Other questions? Question here is the grant available to practices looking to start to providing vaccines? Yes, it is. That's exactly what we're trying to do here. Really trying to get smaller practices, primary care practices that haven't been giving immunizations. And so we're using COVID funds to help so you can do that. And that's the whole kit and caboodle. It's even up through the software. So the state would, while it's a little bit of a rigorous process, ultimately the state would, and I think you would, if you're doing a number of different immunizations and you're asking the state for multiple vaccines, to do that reporting process, to do that in a batch HL7 mode. And again, the nice thing about this grant is you can go and you can select your software, and you can even put in, you can hire somebody technically to help you implement that. Get an invoice from them from what you think it's going to take. And that's something that, we can take care of. And again, we'll figure out an appropriate way. If it's stuff that you're invoicing for, we can say, we can probably hold it aside. We can work with you on if you need the funds to do that. But I think we'll have some flexibility on how we allocate the grant funds to make sure. But bottom line is, we want everyone, all primary care practices to be doing immunizations across the board, COVID and everything else that your practice would normally do. Next question. Same question. Okay. Any other questions anybody might have related to this? And again, if something strikes you or you have something particular that you want, please email me or give me a call. Our goal is really to push the money out as quickly as we can. I'll just reiterate, the first grant period is from now. We'll start looking at grant applications on the 11th, and it'll go through April 1st. And again, if you're putting materials together, you kind of have an idea what you're going to do, but it's going to take you a little longer. Send me a quick email, and what we'll try to do, we'll talk and we'll try to set funds aside for you to be able to do that. So happy to help out any way we potentially can. Sorry. So the question that came up is, I'm a primary care owner of a practice, spent a lot of time since 12/20. How do I account for the time? You can account for it in two ways. Any kind of personnel record basically says that you're there on site. Again, these are retrospective from October 1st, 2021. So it would be for that time period. And the question, we also bought a refrigerator and filling out paperwork in 2012. Can we add that? Yeah, that's a good question. If it's for directly for the provision, you did that because of COVID. It's something I would say apply for, and we can see if the DHH will allow that. The period is technically for October, but if we can say it was for COVID and in the period, then we'll go to work for you to try to argue for that reimbursement, but put it in your application is what I would say. Again, our goal here is to make this as easy as possible for you all, and hopefully we can get this money out to you. Please don't hesitate to email me or call me. And again, it's our goal to put this as quickly and as easily into your hands, these funds, as possible. So any other final questions anyone has? Okay, great. Again, thanks very much for your time. We look forward to working with you. And again, shout out if you have any questions or need further information. Take care, everyone. Thanks for joining us today.